Hi, I'm Julianne Serovich, and I'm Dean of the College of Behavioral and Community Sciences here at the University of South Florida. I've been conducting HIV studies and related to disclosure for over 25 years now. I began my doctoral program at the University of Georgia and continued that work. And we began by looking at factors associated with disclosure. We did longitudinal studies of men and women and trying to understand their disclosure patterns, when they decided to disclose, the trajectory of their disclosure, the decisions around why they were disclosing. And we took that plus some intervention, plus some interviews that we did, and we started designing and pilot testing interventions to help people disclose to their sex partners, to their family members. It began, our previous intervention was just with men, and primarily it was because we were looking at disclosure as a means of HIV transmission reduction. Over time, though, we found that the issues related to women were different. They were primarily disclosing to their sex partners very quickly. They were disclosing to family more often than they were than men were, but they faced special and unique issues. So today, I'm going to be talking about the factors associated with women's readiness to disclose. We believe that we have found that it's being prepared to begin the process of disclosure is just as important as the process and the disclosing itself. And so situations around the readiness is very important for women, and we're trying to understand what's going on and helping them. This is a part of an ongoing federally funded NIMH study, and before I begin, I just want to personally thank the women and the men who have participated in our study, and we appreciate their time and the insight that they've provided for us around learning more about the disclosure process. So let me just a little bit of a background on HIV disclosure. When people become infected, clinicians tell us, and they've been telling us for years, that the idea around who to tell is the first thing that they mention, the first thing that they're concerned about. They're not sure how to tell, who to tell, is it appropriate, what might be the consequences of telling. For men and for women, disclosure can result in HIV transmission risk reduction, especially for men. But we have found over the years, the different studies, that disclosing to family members is very different than disclosing to family, and the benefits and the rewards particularly, which is what we're focused on. So the overall theory behind the work that we do is that if people can weigh out, can understand the risks and the benefits for disclosing, they can weigh it out, and we can find ways of helping them to mitigate the risk that they're more likely to disclose and have a positive experience disclosing. And that's what we want. For many people, it's not that we want everyone to disclose. That's not what's important here. What's important is that they make a decision around disclosing. And so in order to make the decision to either to disclose or to not disclose, we believe that they can weigh out their benefits and the risks, that we can help them think through what may be a good possible outcome for them, a decision for them. So some of the benefits, and there are many, many benefits for disclosing. Obviously, these are the most logical. People have emotional release. They can feel a sense of belonging. There's also the assistance that people can get for getting the medications, et cetera, the social benefits of disclosing. But for women that are pregnant, obviously the benefits would be the same ones, but slightly different. I mean, if they need to have health care, it's easier to ask for transportation. People more can understand that they may need other assistance, like nutritional assistance, et cetera. So to balance these are the risks. And the risks are the things that women are concerned about when they think about telling somebody, whether it's their partner or a family member. We know they experience anxiety and stress, not just about thinking about it, but about the process and about what the outcome might be. And I can say for all the years that we've been doing this, and we've done studies on the outcomes, that if you have a positive relationship with somebody, a family member that you're going to be telling, it may temporarily deteriorate, but in the long run, we find that it rebounds over time. That person needs time to think through and to adjust themselves to the idea that their loved one, family member, is HIV positive. And so for other risks, threats to well-being, possible violence, we know that women, especially women, have experienced violence as a result of disclosing. We have come up with a number of ways of mitigating that for women, and we can teach them how to get through that process without, especially if they fear potential violence. People obviously worry about rejection and discrimination. For women that are pregnant, obviously the other issues of risks, of course, is that now they have to tell somebody not only about their own diagnosis, but about potential of their baby being born HIV positive as well. And so those bring on different and unique factors that women have rightfully should worry about. So let me tell you a little bit about the study. We call it the Disclosure to Family Study, and it is a randomized, clinically controlled trial of a disclosure intervention that we developed for both men and women to help them prepare to make the disclosure decision. We have 150 women in the study, we have 150 gay men in the study, and 150 of what we call the straight bi guys. And these are men that self-report as being heterosexual or bisexual, and we've moved them into one group because previous studies have shown us that frequently men will identify as straight or as bisexual, but only engage in behaviors that are either both or with one partner. For example, men have self-acknowledged that they are self-identified themselves as being bisexual, but only report sex with women. Men have reported that they were straight, but report sex with both men and women. And so they're in one separate group. But what we're going to be talking about today is the 150 HIV-positive women that we have in our study. The participants were randomly assigned to either the intervention or which we call an attention control condition, where basically they received a lot of assistance regarding their daily lives. We help them make referrals to take care of other things in their lives, to make sure they get the medical attention that they need, if they need legal attention, if they need housing, food, other resources. So they came in the same number of times as those individuals in our intervention, but they just differed by what the content of the intervention, but the content was. We had 4 sessions plus a booster, and at the very end we had 2 follow-up sessions where we followed them then for a full year. The data that I'm going to present to you today is from the baseline. This is before we randomized the women into either intervention or a control condition. So nothing's happened with them yet. This is just as they come into the study. Criteria for inclusion: they had to be over 18 years of age. They had to want to disclose or have a desire. No, I'm sorry. Well, yeah, they had a desire to disclose, and they have to have at least one family member that they have not yet disclosed to, so that we can work with them in terms of that relationship. So for today's presentation, I'll be talking about some variables that we thought were important in terms of readiness to disclose. And I'll be sharing with you some information on our demographics, obviously the readiness outcome variable, and then we looked at individual factors impacting women themselves, as well as factors around the family that may or may not be conducive to helping them in terms of their readiness to disclose. And we have a number of other factors as well, such as stigma and disclosure attitude, intentions, and behaviors. And we'll go through each of these measures, and I'll give you some information on the outcomes for each. So here's the demographics. These are women whose median means that half of them were older than 48, half were younger than 48. They were primarily non-Hispanic. They were African American, primarily identified as heterosexual. They were single. 77% have had children. We did not ask directly whether they were currently pregnant, but we do know that 2 were obviously pregnant, and we don't know. There could have been others in there that were, and either they didn't know it or found out later. But most of them, like I said, had children already. Most of them had a high school degree or less. Most of them were employed. Only 35% were unemployed, and they had an income of over $1,000 a month. And they had a median year since diagnosis of 13. And that's really important, because here we're talking about women who half of them have been diagnosed longer than 13 years, half under, but they all still had family members that they had not disclosed to. And so this was still, after, not average, but somewhere around 13 years, they still hadn't disclosed to a family member. And so this is still a process for women, well, for everybody, but it's a process that is difficult. It's not easily resolved. And so this intervention, we're looking to help them move through and navigate making the decision whether they were going to tell or not. So let me talk about some of the measure. What we did is we looked at 6 readiness of change, to disclose statuses. So the first would be they haven't thought much about whether they wanted to disclose to somebody or not. The second, they really haven't thought about it too much, but they're interested in thinking about it now, so they're more ready. They are considering right now whether they want to disclose to someone or one or more family members. They are close to deciding whether or not to disclose. So they're in the more ready. They've already made the decision, but are still willing to reconsider their options. Because just because you make a decision that you're going to disclose does not mean you're necessarily going to do it. We have found that there's a sitting with it. There's a sitting with it to make sure and to think through how are you going to do this, what are the pros and cons, etc. And then they've already decided, and they're going to do it or they're not going to do it, and they're not going to change their mind. And so this is a progression of people in different statuses of the deciding to disclose picture. And this is what it looks like. So about 15%, roughly 15% were in stage 1, another 15 in stage 2, where they haven't really thought about it too much, but they're maybe willing to do so now. Most of them, though, well, 35% and 52 of them were they're actively considering it now that they were going to disclose to probably one or more family member, and then another 15% are close to deciding. About 8% have made the decision but are willing to reconsider, and the remainder have decided and they're not going to change their mind whether they're going to whether they're going to do it or they're not going to. So we have a nice distribution, I think, here. It's natural that most people are considering disclosing to one or more people because that's why they would come to our study. They would see the ad, they would hear about the study, and so it makes sense that most of them are in that middle phase. But we do have them across the readiness stage, across the readiness factors, and this is the primary outcome variable that we'll be looking at today. So what we're going to look at, I said earlier, is the individual factors that are associated, that could be associated with readiness, and these make sense. Things like self-esteem, decisional conflict, and I'll talk a little bit more about each of these, and disclosure self-efficacy, the degree to which she feels like she can disclose is what disclosure self-efficacy is. So let's go through each of these, and I can tell you a little bit about them. Obviously, self-esteem. We commonly know what this is. The measure that we use is a 40-item measure, so it's very robust. The mean score was 5, and the range was 1 to 7. And sample items were things like, I feel confident in my ability to learn new things. I feel my friends and family find me interesting. I feel others do things much better than I, resulting in the negative. So the question becomes for us, does self-esteem, the ability to feel good about yourself, to feel confident in yourself, predict readiness to disclose? The next is decisional conflict, and this is a little more complicated. So it's an 18-item measure, and it's from ranges 1 to 4, and it's basically measuring things like how conflicted are they about their decision that they need to make. So some sample items. I know the benefits and rewards of disclosing. I'm making decisions without pressures from others. My decisions show what is important to me. So it's whether they're having conflict around making this decision or they're not having conflict. And the question is, do those who demonstrate certain levels of high levels of decisional conflict also in a lower range than being ready to disclose? Disclosure self-efficacy. Like I said, this is a 13-item measure. This is self-efficacy is one's belief in their ability to do something, to succeed in some specific task or accomplish something in a particular situation. For this study, we looked at a couple of them. We looked at condom self-efficacy, disclosure self-efficacy, and the ability to negotiate safe sex behavior. And that's primarily for sex partners, partners, husbands, and other types of sex partners. So, for condom self-efficacy, I can use condoms properly. I know how to use condoms properly. For disclosure, I can handle people's reactions to my HIV-positive disclosure. Safe sex, I can bring up the topic of safer sex with anyone. So the question here is, does self-efficacy, the confidence in oneself to accomplish this task, does that impact where they are in the readiness to disclose spectrum? So we found that self-esteem and the decisional conflict were significantly related to disclosure readiness. So women that had lower levels of self-esteem were less likely to be in 1, 2, and 3, stages 1, 2, and 3 in the lower level. So they really had not thought much about it, those with lower self-esteem, compared to those in stage 6 that had decided and they were not going to change their mind. So women with lower self-esteem, I'll say it again, lower self-esteem, were much less likely to be in stage 1, 2, and 3, and much more likely to be in stage 6. Women with more decisional conflict were more likely to be in stages 1, 2, and 3, and 4, than compared to those who were in stage 6. Let's look at some family factors now. Basically, self-esteem and decisional conflict have an impact here. So family factors were coping, relational ethics, I'll talk each about these, and perceived social support, family, and friends. So the idea here is there something about the family environment, about the relationships within families, about the relationship with the woman and her family, does that contain anything that may predict whether she's ready to disclose to them or not? So you can imagine, it's hard to think about disclosing to somebody if the family itself has poor coping skills or if the relationships are not what they consider to be ethical, to be appropriate, to be satisfying, or that they receive the support that they need in terms of the family members. So this is about the family. So family coping, the FCOPES, assesses, again, coping behaviors and problem-solving strategies within families. So basically the primary question that's asked here is, when we face problems or difficulties in our family, we respond by, and it could be seeking advice from others in the family, sharing our difficulties with others, talking to people who have been through this before, or something like we ignore, we watch the TV, we do something different, which would indicate low family coping. Relational ethics is exactly how it sounds. Is the relationship between family members what they considered fair, equitable, and ethical? So this is a 12-item measure, and response 1 to 5. The items that are included in the scale are such that, like, I receive the love and the affection from my family that I deserve from them. Or at times I was used by my family. Or I continue to see strong family relationships across time with my family. Perceived social support and from family and friends, these are both 20-item measures. They measure the exact same thing, except whether it's in the family or with the friends, and we did include the friends for the study. Responses 1 to 4. You see the mean scores up there. So items were, and you can interchange family with friends, but things like, my family give me the moral support that I need, or my friends give me the moral support that I need. Most of the people are closer to their family than I am, or most of the people are closer to their friends than I am. And there's a member of my family I could go to if I was just feeling down and not feel funny about it later. And the same question would be asked of friends. So let's take a look at some results here. Interestingly enough, family factors were not related, none of them were related to the decision, to the readiness to disclose. Not coping, relational ethics, really nothing there. So it doesn't appear as if there's something going on with the family, because you'd think, well, I'm close to my family, I'm more likely to be ready to be right there to tell them. There's nothing that we found in this study that would suggest that that's true. So there's not much that we can do if this would hold out and bear out in other studies to be able to prompt families to be supportive or help them have an open or positive environment. The other factors here were basically about the woman herself and about her attitudes around disclosure, about the degree that she experiences stigma. Again, let's think about this. If I have high levels of stigma, am I really even going to let myself think about disclosing to my family, especially if I feel like they may contribute to the stigma that I experience. So in the disclosure attitudes, intentions, and behaviors here, we measured these primarily regarding sex partners, but I think it gives an idea regarding how people feel about disclosure. Should I be disclosing? What are my attitudes? What are her attitudes about disclosing? What are her intentions around disclosing and her behaviors around disclosing? So stigma is a 40-item measure that examines perceptions of HIV-related stigma. This is range from a score of 1 to 4. You see the mean there is a 2.1. So there's that's a pretty high level, standard deviation of 0.5, a pretty high level of stigma there. The examples of items would be, in many areas of my life, no one knows that I have HIV. Or in the opposite, I've never felt ashamed of being HIV positive, or I've told people close to me to keep the fact that I'm HIV positive a secret. So we'll look at disclosure attitudes, and again, this is a 10-item measure that is regarding the attitudes towards disclosing to sex partners. Again, husbands, casual partners, if they're in sex work, disclosing to those people. So we asked them questions such as, people with HIV should disclose to their sexual partners if they don't choose to use a condom, or even if they do use a condom, if they are having vaginal sex, if they're having oral sex, and there's a whole long list, 10 of them, that we asked to talk about in terms of their attitude. So, do they feel like people should disclose if they're having sex, again, with a condom or without a condom, etc. Disclosure intentions is 6 items that measure their own intentions to disclose. Questions such as, I plan on telling this partner about my HIV status if I have condomless sex, if I have vaginal sex, if I have oral sex, etc., and going down the line of the six items, and whether they agree to or strongly disagree, and these scores are summed. Disclosure behaviors, again, the 6 items, very similar to the intentions, except the difference here is we ask those same questions, but we ask them of, I have disclosed to my sex partners, to how many of my sex partners with whom I've had condomless vaginal sex, or with whom I've had oral sex, or to whom I believe are HIV positive themselves. Decisions to disclose to family was not significantly related to any of those individual factors, not their perceived stigma, disclosure attitudes, intentions, or behaviors. So, what does this all mean? Well, there's a lot going on here, I think. And, these obviously, the only things that seem to make a difference in whether women were ready or not ready were their self-esteem and the amount of conflict. So women with greater self-esteem were more likely to be in the earlier decision-making stages than in the final stages of making a firm decision regarding disclosure. And women with less perceived decisional conflict, or basically uncertainty, were more likely to be in the final stages of making a firm decision to disclose than in the early stages of decision-making. So we have found in other studies that there are other factors that may still reign in terms of disclosure and disclosure versus readiness. And we haven't looked, again, this is the first time we've looked at readiness. But for disclosure, we know that physical proximity to a family member is very predictive. We know that relationship satisfaction is related to the decision to disclose, not necessarily readiness, and that for the actual disclosure decision, it's the relationship. But here in the readiness, it doesn't seem to be the case, and which is interesting. So implications, as I said earlier, this is baseline data. These are women coming in that are interested in the study, still have people yet to disclose to, and have not gone through that process for the most part. So there may be something different about them in terms of where they are in their decision making than women who have decided they're never going to tell anybody, or women who have just go right out and tell family members right away. And like I said in previous studies that we've done with rates of disclosure for women, we find that women tell their sex partners at very high rates. So their partners, their husbands, within 6 months, 92% of those folks know already. And for some people, that's all that need to know is their intimate partner. For others, though, for other family members, it can take up to 10, 15 years for them to tell family members. So this is, again, there may be just something about these women at this baseline that's different. And when we get done with the study, we may be able to take a look and see, did the intervention have an impact on there? And, we did not, while we examined some family characteristics, like we talked about, we really didn't get to the satisfaction, the distance and proximity, like those other factors I was talking about in regards to making the decision to disclose. We didn't measure that in terms of this particular study around intentions, readiness to disclose. So, pregnant women obviously have a double disclosure here, especially if they find out as a result of their pregnancy. And so their readiness to disclose may be very different. Like I said, we only had two women that we knew about, but their needs are going to be different, and especially with that double disclosure in there. So their readiness and their ability would really need to be checked out right as soon as that disclosure, because eventually, as soon as they find out, they're diagnosed, because obviously, while their HIV status may not become obvious to anybody, unless they go to doctor's visits, their pregnancy will. And so we want to make sure that women are prepared, are again ready for that process to begin. The implications for interpersonal relationships, particularly with partners, is very important, especially if their partner did not want them, is not interested in having children. Family relationships, though, for these women are very important because they're going to need the support, they're going to need the help, and they're going to need the assistance. So, for future interventions, though, I think for this particular population, and again, we haven't had enough in our studies to really pull it apart, but it would be important to know that if the skills learned in deciding and helping women disclose their HIV status, help them disclose the fact that they're also pregnant, I think would be very interesting. And those kinds of studies, I think, would be very important for us in terms of moving forward. Do they help women garner the support that they need? Do they help women with wellness, with their nutritional assistance, with their self-care and care for the baby after pregnancy, after childbirth? So I think at this point, I am ready for questions. So there's a question about whether there was any influence from the Department of Health or University of South Florida perinatal program. We receive referrals from anyone, and for this particular project, I don't think that the health department or the perinatal program were specifically targeted for referrals. But what we found in terms of getting women for this project was the local newspaper. Putting ads in the local newspaper resulted in by far the largest number, and the second was going to a local HIV wellness center and sending letters to their constituents, and we got a lot of people from that as well. Can you talk some more about the barriers women experience in disclosing or in them becoming ready to disclose? Well, again, there's all kinds of factors that influence their willingness and the potential barriers to disclosure. We're talking about disclosure here. One of the interesting things about women, and I can talk about this a little bit, we measured in here family support. In a previous study, we found that women who had high social support, who had from family and friends, who had disclosed to family and friends, also exhibited a high degree of depression. And that seemed very counterintuitive to us. Why would people who are receiving the support, high levels of family and friends, why would they feel depressed? You would think it would be the exact opposite. And what we found when we talked to women about this, and we talked to them, our interviewers asked at the end of the studies, like, why is this? And what they said is their friends were very compassionate towards them when they disclosed to them. Their family were very helpful to them, but they couldn't hold the burden that the women had, or how do I put this differently? They felt more burdened by it, and so they were supportive, but they didn't want to discuss it. They just didn't want to talk about it. And so they knew that the woman was HIV positive, but they couldn't handle it. And so they didn't reject her, but they didn't assist her in the ways that she expected that they would, and they just stopped talking about it. The relationship continued. That in and of itself created more of a burden for women. So if that happens early on and you disclose to your best friend and your best friend says, I love you, you're the best person in the world, but I cannot handle that, I can't handle thinking about it, I can't handle talking about it, then you're not going to feel very open later in terms of disclosing to others. I think that's women especially. Men experience almost the exact opposite. Men will, when they disclose, they get the support that they need. But women, for some reason, at least in that particular study, did not. And so, which may be another reason why, in this study, that social support from family and friends was not predictive of readiness to disclose. Thank you very much for your participation in today's webinar. I appreciate that.